Going into the 2023 legislative session, we knew health care would be a major focus for our lawmakers. Now, we've told you about House Bill 7, which would codify abortion rights in New Mexico and guarantee access to gender-affirming care anywhere in the state. The House passed the bill last week, and it now moves on to the Senate. There are also several other smaller measures targeting some of the factors contributing to New Mexico's growing shortage of medical professionals. New Mexico in Focus political correspondent Gwyneth Dolan went to the Roundhouse this week and spoke with two doctors and a lawmaker about how our state's malpractice policies are influencing the problem.
Dr. Angie Bratton and Dr. Nancy Wright, thank you so much for talking to us today. Let me come to you first and say you are from Los Alamos, which has like the highest percentage of people who make a ton of money. You would think in a small community, a small service area like this, you should have all the resources you need to deliver healthcare, and yet you have a workforce shortage. Why?
You know, our big problem is access for our patients, and our workforce shortage makes it very hard to take care of our patients. People can't get in to see me for 6 months. Then I do see a patient, they often don't have a primary care doctor, and they obviously have high blood pressure and diabetes that need to be taken care of. I also see patients that need neurologists or rheumatologists, and I can't find anybody to see them to take care of their serious health problems.
We have low Medicaid reimbursement rates here, but a high percentage of Medicaid patients in general in New Mexico. GRT, is that another problem?
We have several financial problems in taking care of our patients that make it harder to do in New Mexico because of our public policies. One of those problems is that we do have a really high Medicaid patient population with low reimbursement. Another is that we're one of 2 states that require doctors to pay gross receipts tax on copays and deductibles. We cannot pass that on to patients, so that means that your copay, I have to pay some of that in for taxes. We also have some of the highest malpractice rates in all the surrounding states for buying our malpractice insurance. And we also are having trouble with recruiting people, and that makes the workforce shortage makes us have harder, longer days trying to get all the patients in. It seems like, you know, we have 6-month wait, but the fewer patients I see to try to give more care to each patient, that's a longer wait on the other end. We would love to be able to recruit more doctors, but part of our problem is that we don't repay student loans at the same rate as surrounding states. Most medical students come out of medical school with a $240,000 debt, and our loan repayment is only $50,000 after working for 2 years here.
Dr. Wright, you are in Las Vegas, New Mexico. It's a very different community. You've got a huge service area. They're less affluent. You're a pediatrician, and you work as a team with OBGYNs in labor and delivery. We are seeing a national trend of labor and delivery units closing across the country, and this is a problem that you have had in Las Vegas too. How would changing malpractice insurance rates improve that? How could that improve that situation there?
Well, in a place like Las Vegas, it's a small community. We tend to be more poor. There's a lot more of our community members are covered under Medicaid. And although pediatricians and OBs would like to move to a place like Las Vegas because it's a really nice place, and I've been there for 21 years and I love it there. It's very hard to be an obstetrician in a small community because if you're only one of 1 or 2 obstetricians, and you have to be available at all times to tend to someone who is in labor. So you can't be very far from the hospital ever, and it's hard to ask a doctor to do that. Plus, if a patient has complications, if they deliver a baby who is very sick, then the obstetrician and the pediatrician are much more likely to be sued for that. It's very hard as a doctor to be sued. And it's very hard to stay in a place where you feel like there's a big target on you. And so any baby that becomes sick on my service, whether or not it's my fault, I'm going to be sued for it. And that's a hard thing for doctors to work with.
You have smaller facilities in Las Vegas, less specialized equipment and personnel there.
That's right.
For those kinds of emergencies.
Well, for something like a newborn, a sick newborn needs very specialized care. So neonatologists are pediatricians who've had extra training in dealing with critical newborns. And so that's all they do. They don't have offices that they see patients in the way that I do. And there are also neonatal trained respiratory therapists, and there's special equipment that you need for critically ill patients. And in New Mexico, you only have those services in Albuquerque. And so in any hospital outside of Albuquerque, you really don't have those highly specialized services. And so if a sick baby is delivered at Alta Vista, and right now we don't have an obstetrician, but a baby can still be delivered there without an OB, so they're delivered in the emergency room. And then a pediatrician like me would have to come in and take care of this sick baby until it can be transported out to the intensive care unit. And this could be hours. I've spent 12 hours at the bedside of a very sick baby waiting for the transport team to come. And if that baby does not do well, then I'm the one who's sued, even though I'm the one who's really working very hard to keep this baby alive. It's a very difficult situation. It's impossible to get new doctors to Las Vegas. So we don't have obstetric services at all. So no babies are delivered in an official labor and delivery unit. And that deprives our community of a place to safely deliver a baby. It's a very critical situation.
And I believe that obstetricians often pay at least $100,000 a year for their malpractice insurance. And that means that they're having to work the first part of the year just to pay for malpractice. That doesn't pay for their staffs, that doesn't pay for the equipment that they need. It's a money-losing proposition to deliver babies.
Representative Thompson, you're a physical therapist. You are often up here working on healthcare-related issues. One of them is a proposal that would ban flavored tobaccos. And really what that means is fruit-flavored Juuls and things like that, vapes. This is one thing that we know teenagers are still doing. How is that going?
I'm afraid it's not going to make it this year. It is really important. We have a study that says that 34% of high schoolers are normal vapors, and we know that. I mean, I can't imagine a 2-pack a day smoker of 60 years is going to go get Tutti Frutti. So what we're trying to do is prevent kids from ever starting, because nicotine is an addiction. And Dr. Zadonis, who is at UNM, is an addictionologist, and he presented to committee over the summer and said that nicotine is indeed the gateway drug to all other drugs.
You are also working on prescription drugs. This is something everyone can identify with. What are you trying to do?
Well, I'm trying to protect patients. I have a bill to get diabetic supplies. I have a bill to allow people to have the freedom to use their local pharmacy as opposed to a mail order pharmacy if the local pharmacy can meet the price of the mail order. And what part of the reason for that is in rural communities, if they have a pharmacy, that may be the only healthcare provider they have. We had a member here who was getting sicker and sicker. He was quite old, and he went into his pharmacist, and his pharmacist looked at him and said, "Whoa, we need to change some things," and then he got better. So, we cannot afford to lose any healthcare provider anywhere in the state.
We have been talking today about the provider shortage in New Mexico. We just talked to some doctors about malpractice rates. How do we need to solve this problem? What do we need to do to address malpractice insurance rates here?
Well, if I had that answer, I'd be very happy. I don't. But essentially for me, it's about the patients. You know, I mean, a $750,000 cap on an injury or a death it's just not enough. I mean, my own brother, 6 girls, 1 boy, the only brother, had a heart attack, and when he collapsed, he hit his head on a sink and then on the floor of the bathroom. And they only treated his heart. And all night long, I watched him essentially dying and kept asking the nurse, what about his head? What about his head? Because he had a baseball-sized knot on his head, and they kept telling me, we're watching it, we're watching it. And to this day, I feel guilty that I wasn't rowdier and demanding. It was just a sad day. So I know how it is to lose someone you love or have someone you love badly injured, and the cost of their care through the rest of their lifetime can be in the millions. So I'm all about patience. I hope someone comes up with a plan for it, but patients need to come first as far as I'm concerned.